Whenever you want.
So here we are at our next episode of the Ben and Gary Show. We know dentistry, and we're always taking our questions from our listeners and our individuals who look at our videos. And one just came through from a 71-year-old individual from Seattle, and she wanted to know about her teeth, and that when she looks in pictures, older pictures, she has a great smile, but more recently she tries to smile and can't really see her teeth and wants to know what her options are. And when she goes to her dentist out there, what kind of questions should be asking them? And I guess, Gary, when I think of an individual like that, because they didn't really send us any pictures, I'm thinking about the kind of teeth that look worn,
right,
flattened off.
Right.
They probably look a little dark, and then when you look at them a certain way, a lot of times they'll have these little crack lines that are in them,
right.
And I think we usually refer to those as craze lines,
right.
And those are kind of similar to, like, my grandmother has a set of old china, and in that china, after enough times in the dishwasher, you get these little lines all in them, and they look like little fault lines or crack lines in them, but yet when you kind of run your sharp knife or over top of that, you can't really feel it. So therefore the crack is sort of like in the porcelain versus this is exactly what it's like when you have enamel, that when you look at it and shine a light on, there are these little craze lines in them, and that really is a function of force. It's a sign of that there's too much force on your teeth. People grind their teeth, and over time they use them for different reasons that they shouldn't, opening certain things and biting their nails habits and things like that can lead to stress cracks, and they're called craze lines. Those eventually do what? They pick up stain.
Yep.
They advance the process on making your enamel chip off.
All right. That's what I notice a lot is tooth-to-tooth wear, and then you obviously will have chips right on the corners of the teeth, especially the anteriors. And if there's wear in the posterior teeth, then of course the same fractures can sometimes get a little deeper and actually cause some of the tooth structure to separate from the main body of the tooth. And so those are all things that we look for as far as the things that need to be restored.
Yeah, it probably also means your enamel is wearing away too, because if you think of how your tooth resists the stresses, is that it has enamel wrapped over top of what we call the inner part of the tooth called dentin. Dentin is a more yellowy looking part of the tooth anyway. As your enamel thins out, then that same color then transluces through the enamel, giving your teeth, making them look yellower, darker. Those crack lines become more prominent, or those craze lines become more prominent, and craze lines can eventually lead to a true crack line where you can feel with a sharp instrument a surface defect. That's when our coffee, our other foods that can cause stains on teeth can actually get into the tooth, and along with that, bacteria can get into those areas and cause greater fractures in that tooth. So over time, that's what's going to kind of mount up. And little parts of the tooth either wear off or chip off, and you're unaware of them. You don't really pay much attention to them. It happens so gradually. Eventually, you find out that your teeth are getting shorter, and unfortunately, as time goes on, gravity takes effect on your tonicity of your muscles. And when you try to smile, your lip now shrouds your teeth even more, but you've also worn your teeth. You can kind of understand the progression of how this is going to go, and I think as a patient, if I'm that individual in the chair wondering what can be done, I would simply just ask my dentist, listen, I'm starting to notice some changes here. What's out there in the world of restorative or cosmetic dentistry to be able to improve the look of my teeth? We've talked in this program quite a bit about veneers, about crowns, and that's certainly an obvious option. People also ask us about bonding. Quite frankly, bonding works really well when you actually have enamel and tooth. But as you've worn it away, chipped it off, and just in general made your tooth look darker, bonding is probably not going to be enough. It's probably not going to hold up. Listen, the enamel is the hardest substance in your whole body. And if you've worn that away, you can believe me, you're not going to be able to, just with tooth-colored filling material, which is what bonding is, rebuild your tooth and expect it to last. It's probably going to work for a little while, but you're going to grind through that as well. At this point in time, you got to really consider doing something else, covering the tooth, either on the front in the edge with a veneer, or in total with a full crown. That's where you can rebuild and just kind of essentially start over again, and that's really what it takes. patient then asks us, how many do we need to do?
Right. Yeah.
How many is it going to take to kind of restore the look, the youthful look?
Right. So it depends on your bite. What kind of bite do you have? Do you have end to end, where your teeth meet, or do you have a little bit of overbite and overjet? So that's where your teeth will actually overlap the lower teeth. Your upper teeth will overlap the lower teeth. So those are things that we have to look at in order to answer that type of question. But
how broad's your smile? What do
Yeah.
you see? It's kind of hard to be able to make somebody's whole set of their teeth look much better when you
Right.
say you're showing, say, 12 teeth, but you're only doing 4.
Right.
Well, then, honestly, you're kind of beholden to the fact that you have to make 4 teeth fit into a big picture and make it blend versus sort of changing the whole picture.
Right.
Far easier to be able to do that. It's actually the most ideal way to do it is to do whatever teeth are actually in your smile. If you're trying to do teeth that are not in, or just a few teeth in your smile, then you have to make it blend. If whatever you're trying to make it blend relative to is not in great shape, guess what? Your crowns really probably can't be all that great because, well, they're going to stick out. And people are going to say, great looking crowns. That's not what you want to have. You'd rather have a great looking smile. I mean, I would.
Yeah.
So
one other thing that you should ask your dentist is to have them assess the bone levels. The gum and the bone that supports the teeth that are important. So they'll have to make sure that everything's sound, and the bones that support the teeth then can then support any type of restoration that they recommend.
I mean, if you're building a house, it's all about the foundation. You can build a wonderful house, and if it's on a poor foundation, hey, listen, I don't think your house is going to be there that long.
Right.
If you think about the dentistry and what we do in the same way, if you don't think about the gums, the bone around them, and get that set correctly, then you can spend a whole lot of money, time, and waste it on a poorly designed process. So that starts with an assessment. We need to look at very, very closely at what's going on under the gum as well as what's going on above the gum, what you can see. So it's just not about being able to stick some caps on your teeth. It's a total assessment if you really want to get it done correctly and have it to last.
Yeah.
So more dentitions can be improved. It is a
be.
methodical way about being able to make sure that that's done correctly and how many teeth it should be done, with the idea that longevity is what we're shooting for. And listen, dental problems are chronic. Once you have one dental problem, it's going to be with you for the rest of your life. It's just a matter of when do you need to actually treat it. The idea is, how do we kick that can down the highway as long as we possibly can, and that when we then finally get to it, it's going to be far easier to treat it then than it will be if you did not consider that. So that's what my recommendation would be, is to make sure that you're going to be going to someone who knows what they're doing, who can speak to you about what your problem is, and is not interested in simply just jumping in and solving that problem without sort of creating a master plan. Mm-hmm. Honestly, that's the question I would be asking. There are different gradations of abilities, but honestly, if you don't have that in mind with the plan of what the end point is going to be, then you should probably not be considering going to that dentist, or that dentist is not the one for that kind of treatment. It might be great for fillings, getting your cleanings, maybe a single crown here and there, but when you're going to reconstruct your personality, you need to go to somebody who knows what they're doing. So that's just a little tip, I guess, from the Ben and Gary Show. We know dentistry. We're always looking for your questions. Keep them coming.